Well, good evening, everybody. First of all, I want to thank everybody for taking time out of their busy schedules to join us tonight. This is my maiden voyage for a Zoom meeting or Zoom webinar, and I'm really looking forward to being with everybody tonight. After the stay-at-home order has been lifted, it's great to be able to sort of get out and see our friends and get together with our colleagues. And so this is a great opportunity for me to share with you what I've been trying to do for the past several years with PAMED. As some of you or most of you know, physician wellness and burnout is something I've been looking at and studying now for almost 3 years. And to have an opportunity to share some of this with you tonight is really special for me. So once again, thanks for everybody for spending time tonight. We'll take questions afterwards. We'll be able to unmute you and answer your questions. We thought that would be easier than trying to take questions during the presentation. Jim, if we go to the next slide. So at PAMED, we've been trying to push the art of medicine as a theme over the past couple of years. We all know that the technological side of medicine has been difficult and has been demanding. We're trying to have less paperwork and more face-to-face time with patients. We want less tech and more touch. Right now, touch, of course, is very hard in the COVID-19 era, but PAMED has been very influential in trying to bring us back to our roots of the art of medicine. And maybe some of you have seen the campaign, but this is part of our campaign, and we're happy to share that with you tonight. Next slide, please. So a view around the table tonight, most of you will recognize this as Falling Water. Falling Water is our UNESCO heritage site in Western Pennsylvania. We're so fortunate to have Falling Water in our backyard. For those of you who haven't been to Falling Water, I strongly recommend taking your friends, neighbors, and visitors to Falling Water. It's such a treat to visit our Western Pennsylvania mountains and to hear the history of Falling Water and Frank Lloyd Wright, who designed Falling Water. Falling Water, to me, I think represents a very good analogy for what we're facing in medicine today. Frank Lloyd Wright was challenged with trying to bring out the beauty of the site over the waterfall with the forces of nature that were battling against him to develop such a beautiful piece of art in the middle of a stream. To me, Falling Water beauty represents the joy that we have in medicine. The waterfall, building a house on the side of a cliff, the harsh winters that we have in Western Pennsylvania, I think represent all the difficulties that physicians are being asked to handle. So you have to handle the forces that are pulling against us that are not allowing us to take advantage of the joy that we have in medicine. And I think Falling Water really represents the yin and the yang that we struggle with every day in medicine. And I think if you have a chance to go visit, you'll understand this more. Most of Frank Lloyd Wright places are best viewed and understood when they're seen in person. It's really hard to gather the beauty and the genius of Frank Lloyd Wright without seeing his places. Guggenheim, Taliesin are good examples, but I think we're so lucky to have Falling Water in our backyard, and I would encourage you all to take a visit. Next slide, please. So tonight our goals, and I think everybody knows we get some CME credit. Tonight our goals are to identify the factors at the individual and organizational levels that help create our understanding of burnout, and to identify and incorporate strategies and tactics that help mitigate the burnout and stress that we're all under. And I think that after spending time with you tonight, we'll have a little better understanding of why we're struggling with burnout and why it's such an important topic. Next slide, please. So what is physician burnout? Of course, it means different things to different people, and it depends who you read. I've probably read over 200 or 300 articles on burnout now, and everybody has a little different take on it. But this is one of the definitions. You can read through that. And I think everybody understands that it's the occupational stress that we all feel with being physicians that make us understand how easy it is to get burned out. There's so many stresses that are pulling and pushing at us that it's all around us, and I think we see it every day. Exhaustion, cynicism, detachment, the sense of ineffectiveness is something I think we all can identify with. Some people have wanted us to change the term physician burnout to physician moral injury. Moral injury has been a term that's been used in police work and in the military. And I have to bring it up because every time I give this talk, somebody asked about moral injury. So I've included a little discussion. We had a webinar with the Massachusetts Medical Society, and the folks up there would rather focus, I think, or would like to focus more on the moral injury part of it. And what they're stressing is that the physicians are being asked to do things that they don't have control of, they don't necessarily agree with, and that leads to a moral dilemma. When you read about burnout, burnout talks a little bit more about resilience and wellness. And so there's a little bit of a struggle with folks who see moral injury as something that the outside world has to fix and not put upon us. And some people talk about wellness and resiliency as us responding and making us better to deal with the stresses that are upon us. I just wanted you to be aware that that the term moral injury is out there. We all know that burnout is a public health crisis, and it has to be at least addressed. Some people have written to me and said, well, I really don't believe in burnout. I don't believe physicians are struggling that much. It's just a lot of people whining about things they should be able to take care of. But if you've read any of the medical literature lately, you know it's throughout the entire scope of medical literature. This is a copy of the New England Journal of Medicine lead article from May 4th, talking about physician burnout interrupted. Just one of the many articles that are out there, but I think we all know and respect the New England Journal of Medicine, and they've had multiple articles. There's even one after that by Tom Naska, again, talking about updating burnout. This is a copy of the New York Times, dated May 17th. The headline reads, "I can't turn my brain off. As medical workers bear the unbearable, the burnout is smoldering." And we all can appreciate how COVID-19 has already added another layer to our stresses that we're dealing with. This is from the Pittsburgh Post-Gazette. This is dated May 15th. There are no heroes in this world. They talk about in 2019, the World Health Organization expanded the definition of burnout from a state of exhaustion to a syndrome resulting from chronic workplace stress. And that was before the pandemic struck. So I'm just trying to add validity to the conversation that this is a very hot topic. Many people are talking about it. We know that according to that New England Journal article, that the expense, the cost to medicine has been estimated to be $4.6 billion. And we'll get into why that is as we move forward. We know the effect of burnout affects quality of care, patient safety, physician turnover, and patient satisfaction. And again, we'll talk about that more moving forward. Next slide, please. So there's a lot of statistics out there regarding burnout. A lot of the health care systems have done their own surveys. Mayo Clinics, Stanford have been sort of the gold standard of statistics. I know UPMC did their own survey, but all the surveys, and if you look at them again and again and again, show that there is a major percentage of physicians reporting burnout, and with one or two more of the symptoms and signs of burnout. one may question the validity of the statistics of it because maybe not enough physicians answer it. But as you can see, one of the surveys had 15,000 physicians from 29 specialties that took the survey. And I'm just trying to build the case that this is something we can't deny. It's out there and we need to talk about it and address it. Satisfaction with our work-life balance has declined. Tate Shanafelt started his research in 1998, and a lot of his papers were published between 2011 and 2016, and that's when the decline in patient satisfaction with physician satisfaction was greatest. Now, I will tell you some of the newer literature and some of the newer surveys that have come out in 18 and 19 has shown a little decrease in satisfaction numbers, that the numbers have gone down and the more physicians are reporting a little bit more satisfaction. 54% of the most recent survey, however, reports that at least one symptom of burnout is something that physicians have been experiencing. Next slide, please. So it's not hard to understand why physicians are more at risk than the general public. If you look at this slide, you see that physicians are putting more hours in, they're experiencing greater burnout, and their work-life satisfaction integration numbers are, I won't say skyrocketing, but compared to the general population, are significant. And again, these numbers, this is from the AMA. If you look at the bottom, there's various sources in here. It's hard to give a total bibliography of all the statistics, but they're out there. Again, Tate Shanafelt started this discussion, and he's probably published over 200 articles on this. And so I think the statistics are reliable is what I'm saying. Next slide, please. Sorry for the blurriness of this. Now, this is an interesting slide because when I first started looking at burnout, I can tell you that some of this slide was the other way around. Interestingly enough, 4 years ago or 3 years ago when this slide came out, critical care, emergency room medicine, and family medicine were almost in the top three. This most recent one is a 2020 summary survey you can see, but I will tell you that I got this in early February, and it was before COVID-19. And I really wonder now if we had one today, if in fact critical care, emergency room medicine, primary care wouldn't be back up at the top of this. But I don't know that I have all the answers as to why the numbers and the specialties are the way they are. But I think talking to the crowd tonight, we're all in different specialties and everybody can relate to their own specialty and how burnout applies to you. But it's interesting that ophthalmology, orthopedic, psychiatry, otolaryngology, and general surgery are on the bottom here. But again, I think COVID-19 has probably changed that mix a little bit, and they may be moving up. Of course, the financial strain of COVID-19 on all practices and all specialties has affected, I think, the stress that we're experiencing as well. Next slide, please. So this is sort of burnout by specialty and comparing specialty by to primary care. Again, I don't need to break this down for you. You can see that there's still a large number below unhappy, and that primary care always, I don't want to say always, but almost always in all the surveys have a higher number of unhappy people versus the specialty. So again, we can all sort of feather out why that's the case, but we'll get into that a little bit more moving on. Next slide. So when you read through the literature, it varies as to how they try to explain the generational differences in burnout. Just by definition, the millennials are between 1980 and 1994. Generation X is between 1965 and 1979. And of course, the boomers are from 46 to 64. And there's been a lot of debate as to why the generation seems to have little different numbers. Generation X, I think people feel that they're the ones who are juggling the sandwich society. They have parents that are maybe sick and demanding. They have families, children. So they're sort of caught in between their parents and their children, trying to juggle everything we're asked to juggle. That seems to be the biggest reason for Generation X. The millennials, I would tell you, in the newer surveys seem to be climbing up. And the boomers, unfortunately, I think, besides just burning out, have decided to retire and move on. And so most of these surveys show that there's less and less boomers around to answer the questions. Next slide. So again, everybody knows the ages of the millennials, Generation X, and boomers. Again, you can look at this slide. I don't need to go through it. It's interesting that these are the top 3 contributors. And I think if you asked yourself what things sort of bother you the most, the bureaucratic tasks, the long hours of charting, the hours at work vary a little bit, as you can see by generation. Spending too much time at work seems to be a little lower for the boomers. Again, say in my own case, my kids are grown, they're out of town. Putting more hours in isn't as much of a demand as it was when you were raising 4 kids, having a wife that worked, and trying to juggle Little League, soccer, baseball, and everything that the kids were doing. So I think the boomers are frustrated with the bureaucratic stuff, as where the Generation X people, for example, lack of respect from administrators. They may be trying harder to work with changing the system and feeling frustrated with how hard that is to do. I may add at this point in time that no matter who you read, or no matter how much you engulf in this topic, there are no easy answers. Part of the answer is having the discussion. And as everybody can see from the last 5 years, with this topic becoming more and more obvious and more of a public health crisis, there's much more attention, even though we don't have all the answers. There's much more discussion and attention being spent on it. And I think that's part of my goal, is just trying to get the word out and having people talk about it more, and trying to work at it from all different angles. Next slide, please. So how happy are you with your work life? Again, I don't need to break this down for you. You can see it. I think that this is a newer survey. You can see it came out in 2020. And what I think this represents is, if you look at the early surveys from 2011 to 2016, you would see a lot less happy people in the top graph. That the pendulum is definitely swinging. I'd like to compare it to when I first started out in organized medicine. We talked about the crisis of primary care physicians. Medical schools were graduating so few doctors who wanted to go into primary care. We started the discussion probably back in 2010, and now we see that more and more people seem to be interested. I think it was the conversation, trying to answer more questions, having more exposure, and I think this slide represents how we're moving the needle a little bit more toward making folks a little happier. And so that's why I'm happy to continue this conversation, because I do think it's having some added effect and some value. Next slide, please. Again, I don't need to break this all down. You can look through it. I think for the, again, the Generation X folks, you can see down below there, they have a strong and severe impact upon their life. I think, again, they're the ones that are getting caught in between. I can't pretend that I can explain all this, but this is just information I wanted to share. I would tell you, when I've gone out to give this talk before, the younger folks in the crowd wanted more information for generation by generation. they thought that they were the ones who were, they were the only ones having the problem. So I introduced some of these slides to show that the millennials really weren't the only ones who were struggling with the burnout crisis, that it really did go across all the generations. Next slide, please. So the relationship issue is huge, and you can see that there, and it's pretty consistent through all ages. And one of the reasons I included this slide is when I went on, there were a lot of young physicians in one of the last talks I gave, and some of the young women came up and mentioned that they really feel that they're torn in so many different directions. You know, their mothers, their wives, some of them are residency directors, some of them are being asked to do so many different things, and they didn't feel I had really included the impact by the generations. And the generations are sort of defined by their experiences. A lot of this information is shared by what affected the generations as they were coming through their education. And just for example, the millennials, they talk about were affected by the Columbine experience, 9/11, the 2007 recession, and of course the invention of iPhones. A lot of people feel the iPhone had, as we think of it as such a tool to help us, really began the process of disengaging people and let more time in front of screens and less time in front of people. For the Generation X, it may have been the Berlin Wall, Watergate, 3 Mile Island, the invent and the explosion of computer work, and the Challenger exploding when we thought technology was the answer to everything, and then the Challenger explodes. And all these things have subtle and different effects on people's values and their morals and their philosophy. For the boomers, they talked about the 60s. I haven't had a haircut in 3 months. They said today, I told somebody the hippies have won, because the hippies said all the weed you want, now it's unlimited. No haircuts for anybody, can't get a haircut, and everybody gets free money. So the word I heard today, the hippies won. But for the boomers, you know, it was the 60s, the Kennedy assassination, civil rights movement, the space race, of course, Vietnam, and don't forget the Beatles. So your relationships are all affected by who you are and what values you have. And with all the stresses we have on us, everybody sort of agrees that our relationships are struggling and suffering, and we need to figure out a way to improve that. Next slide, please. I thought this is an interesting slide in that, again, this is from Medscape 2020, how physicians are coping with burnout. Again, you can look at yourself at the different generations. I thought it was interesting that the millennials have sleep as one of their best ways to cope, is where the boomers don't put sleep down as one of the best ways to cope. Again, when we look at trying to solve this problem, it's so multifactorial that there's no obviously one answer to solve the problem. And this just, again, gives you an idea. Again, as we talk about burnout, we're trying to include resilience and wellness into it. We want to build up wellness in the medical practice. We want to build up resilience. These are some of the ways that people do it, but there's a lot of other ways to go about it as well, and we'll get into that more. Next slide, please. So interestingly enough, John Middleton sent me an article from the Journal of the American Board of Family Medicine. It just came out, and it was burnout among family physicians by gender and age. And the bottom line was that women appear to be much more affected and at a younger age. And again, I don't know that this is any earth-shattering news. Women and females are juggling so many things in their lives. The traditional roles have changed. And I think one of the important aspects of this slide is that we all know the workforce for particularly primary care has shifted tremendously by gender, and that we have so many more female primary care physicians than we did when I started. I think in my medical school class, we had 140 students and probably 30 were female. And now I think we all know that medical school classes have more female students than they do male. And this, I think, is just important because if we have more females in the workforce and more females burning out, the question is who's going to be around to take care of people moving forward. And again, I don't have that answer, but at St. Margaret's, I think 1 year out of 14 residents, 10, 11, or 12 were female. So we all know that those demographics are changing. But I wanted to include this slide in it because Dawn just sent me this article last week. Next. So here is an interesting forum that I went to a couple months ago. I'm not sure if everybody recognizes the person on the left, my left. That would be me. The person next to me, if you don't know who that is, that's Brooke Shields. And I went to this wellness conference where well-known people in the world of wellness, so to speak, came to talk. And Brooke talked about her postpartum depression. She talked about the stigma of mental health diagnosis as a mental health illness. Some of you may remember that Brooke was very visible with her postpartum depression. She came on TV. She had a lot of interviews talking about her near suicide, and then subsequently was criticized by Tom Cruise for talking about it, saying that there was such a thing as postpartum depression, and then admitting that she was taking medicines for it. She talked candidly about how close she was to suicide, and that without the help of her health care team, she was convinced that she would have probably committed suicide. And she's trying to get the word out that mental health diagnosis and mental health illness shouldn't be stigmatized, and that it should be more freely talked about. And in medicine, we all know that doctors are very reluctant to be labeled. They don't want to admit to some of the struggles that they have. But Brooke was very forceful in convincing that the more we destigmatize it, and the more people go for help, the more people we're going to save moving forward. On the right-hand side, I'm not sure how many of you recognize this young lady. This is Muriel Hemingway. And Muriel Hemingway came to talk at the conference. Unfortunately, I didn't get a picture with her. But she, as you may know or may not know, she's had 8 people in her immediate family commit suicide. Her sister, Margot Hemingway, committed suicide at age 26. And she's written 2 books, and her discussion really focused on that suicide prevention works. Suicide prevention needs to be discussed. We need to help identify more people at risk for suicide. And again, we have to make ourselves much more available to let them know that this is not the answer. Maybe most of you or some of you know that 1 physician commits suicide every day. The average is between 300 and 350 physician suicide a year. That would be 1 to 2 medical school classes a year. And that's really unacceptable. We have to figure out a way to decrease physician suicide. Some of you may have already heard this story, but I'll tell it to you again quickly. Pam Weibel is a woman who has studied over 1,200 physician suicides. She, when she hears about a suicide, she goes to the town, she talks to the family. She has meticulously, in a sense, dissected why a lot of these physicians commit suicide and how they go about doing it. Tate Shanafelt is the premier researcher in physician burnout. Both of these folks have done TED Talks, and I would encourage you to look at their TED Talks. They're very dynamic and very good. But I was to dinner with Tate Shanafelt and to dinner with Pam Weibel talking about physician burnout when a third speaker who was going to present the next day came and joined us for dinner. This was a woman who had worked in a pediatric emergency room, and unfortunately sent a 20-year-old woman home one night, and the next morning she was found dead. And this young woman physician questioned her ability to be a doctor, how good she was at doing what she was supposed to be doing, and actually she became suicidal. Of course, she was sued. She lost her malpractice suit and was on the verge of suicide when she decided she would go to TED Talks. And she saw Tate Shanafelt's TED Talk, and she saw Pam Weibel's TED Talk, and they talked about how suicide can be prevented and helped. And actually, a lot of suicidal folks, it's been shown, once they've had a gesture or attempted suicide, if they get the appropriate help, they don't do it again. They sort of see the light and can move on. But this young woman came to join us for dinner, and she sat down and she said, "This is so ironic because I've never met Tate Shanafelt before, and I never met Pam Weibel before. But when I was being sued and after this young woman had died and I thought I had done something wrong, I became suicidal. And what I did was watch both of their TED Talks, and they saved my life. And by listening to their TED Talks, I realized there was hope and there was a reason to live. And now the irony of me having dinner with them tonight, I just wanted to give them an expression of gratitude for all that they had done for me. And now her focus was helping to prevent physician suicides moving forward. And that's what was her presentation. So I just wanted everybody to know that most of us probably have known a physician who's committed suicide. I've known at least 4 in my years at St. Margaret's. And it's a tremendous tragedy when these things happen. And I just want everybody to sort of be aware of their surroundings and help physicians that you might see are struggling and make yourself available. Sometimes just a friendly gesture to somebody struggling can mean an awful lot. Next slide, please. So this is one of my most favorite slides of all that I've seen out there, this one and the next one. And we talked about relationships and how they're affected, and we've talked about the professional side. So if you look at all, we'll go to the personal side first. You look at broken relationships. Again, we all know about divorce. We all know that children can disown their parents when their certain behavior isn't changed. We know how parental relationships can change when people are struggling with depression, suicide thoughts. And this is one of the things that when we fix personal relationships or help personal relationships, the amount of burnout goes down significantly. And so I think relationships is something that we need to focus more on. Going down, we know about alcohol and substance abuse. I would tell you, I was talking with the people from Massachusetts where cannabis is now legal, and they were talking about how prevalent marijuana has become among physicians, both self-medicating or recreationally using it, and they're very concerned that it's going to replace alcohol and other drugs because it's now accepted as something to be used. And their physician health system has taken in, they said, more people abusing marijuana than they had ever seen before, and their numbers have skyrocketed. We talked about depression, and we talked about suicide. This article, as you can see, comes from Tate Shanafelt in his 2016 papers. And I would highly recommend, if anybody's interested in reading more, he's the guy to read. On the right side, you see the professional side. We talked about this earlier. We know that the quality of care decreases. We know medical errors increase significantly. We all know about Press Ganey and how it plays into our lives. And we all are very discouraged when we get a bad Press Ganey score or report. People talk about the validity of Press Ganey. I've been to 10 or 15 Press Ganey seminars, and the first thing they try to do is reassure you that their actuarials know what they're doing, their statistics are valid, and that everybody says it's just patients who complain throughout the forums. But we know that that's not the case, and we know patient satisfaction plays a big role in how we feel about ourselves and how we feel about the job we're doing. Decreased productivity, again, we all, I think, understand that. And physician turnover is really huge because it's very expensive for a system to replace physicians when they leave. It's estimated that it costs $1 million to replace a physician when a physician leaves a system. And I think we all can understand that. I think part of what this slide shows is that problematic behavior leads to teams that just cannot function. And we're all sort of working in teams right now in one way or another. And when you have a problematic person in the team, the efficiency goes down significantly. Next slide, please. So what do we know? Well, we know on an individual level, we should see and understand and look for burnout, because I think most of us know somebody who's been struggling. We know that it's reversible, and we know that it's treatable. We know that institutions play a role. We all those who are employed understand how much an institution has an effect on our behavior and our motivation, and that we also are asking institutions to look at themselves and ask how they can begin reversing the trend in burnout. And again, I think if any of us work for a system anywhere across the state, you see that institutions are getting the word, and there's a lot more discussion. I went to a seminar not long ago with a Buddhist monk who was the physician of the Dalai Lama, and to hear what somebody like that talking about what physicians go through and how he is trying to change institutions, not just for physicians, but for nurses, for nurse practitioners, for PAs, for our office staff as well. We know that the institution has a great effect upon the entire health team, and how we're trying to get the word out that they need to be more sensitive to our needs. What we do know is that the electronic health record has had a great effect upon us. We know that pajama time should be more for families and not paperwork, and that somehow we have to have the electronic health record work more for us rather than us working for the electronic health record. And hopefully that's going to evolve as time goes on. But we know that the electronic health record has had a tremendous effect on burnout. We know that vicarious trauma plays a big role. You look at young residents who are involved with code after code. Sometimes the codes are successful, but a lot of times they're not. There's families involved, there's loved ones, children, spouses, and the residents who are working so hard to save these people's lives. When they have a bad outcome, it's has a very large effect upon them, and this vicarious trauma has been a big issue. We know that compassion fatigue has been playing a role. We all, as physicians, as I've been saying in a lot of the articles I've been writing and interviews I've been giving, is that compassion is in our DNA. We've risen to the occasion to help with this COVID-19 crisis because that's what we do. But sometimes we run out of compassion when we get home, and that's how it affects the relationships at home because we spend our compassion at work. We know that the bureaucratic tasks we've been asked to do has played a huge role in wearing us out. And one of those good examples of that is prior authorization. We're trying to fix some of these bureaucratic tasks, certainly at the organizational level and at the organized medicine level and the legislation level, but sometimes it's hard to turn to Titanic. And we're trying very hard to fix these problems since we know that they contribute so much to the stress that we have with burnout. Next slide, please. So on a personal level, the risk factors that have an effect on making us higher at risk. Again, I don't need to go through all these, but you understand all these play a role, and have a big concern in changing the dynamics of burnout. Of course, now we have to add to this COVID-19 and the dilemma that COVID-19 has added to our lives in trying to find good work-life balance, exposing our loved ones to risk, trying to protect, if it may be parents or grandparents, while you're protecting your kids and your spouse. It's not been a very easy thing to do. I don't need to go through all these, but you all can read those and I think relate to them. Next slide, please. So again, this is another statistic, a recent one from Medscape survey. We've talked about some of these, but here I think is a general layout of the things that affect the stresses that we have in our lives. Interestingly enough, you see that electronic health records is not number one, but further down the line, but certainly plays a big role. Next slide, please. Again, this is one of my favorite slides. If you look at each one of those bubbles, I think all of us can relate to each bubble in one way or another. If it be patient satisfaction, if it be online reviews, if it be transparency in our office notes. You know, some of us have gotten calls. Why did you put that in your note? Why did you say I was depressed? Why are you calling me obese? It's you know, each bubble has a tremendous meaning for all of us. And you can see there's multiple bubbles. And now at the bottom of that, we have to add COVID-19. And what we've learned from COVID-19 is that it can make stable problems a lot worse, particularly for the frontline workers. You know, things like PPEs add stress, gag orders when physicians may want to talk about the stresses they're having. The frontline, we all know about the emergency room physician in New York who committed suicide, and what a tragedy that was. So again, this is one of my favorite slides, and it just it goes to show how many things are pointing at us. Next slide, please. So this is another Tate Shanafelt from 2016. Again, you can look at that, and while you're looking at it, what I'd like to do is, if you look at burnout, exhaustion, cynicism, inefficiency, we talked about that, but we also, I think, need to include there a loss of meaning in our work, a loss of support in our work, and the disengagement of leadership that we see sometime in our work. I think leadership is so important, particularly when you're working in a system or when you're working in even a large multi-specialty organization, that leadership is so important. And I think we need to develop better leaders, and we need to let our leaders know what more needs to be done. If you look on the other side, as far as engagement, I think, you know, what I'd like to add there is altruism, and add sort of the joy of what we do. What we do is very special. Becoming a physician was very hard for all of us to do, and staying a physician is very hard for all of us to do. But what we need is the joy and that doctor-patient relationship, and understanding that what we do is so very special, and we need to find satisfaction in the work that we do. I think on this side, we can also add coaching, support groups, connectivity, and reaching out to our colleagues, the collegiality that is so important in our work. We've lost some of that. We've lost physician lounges. A lot of us have not gone to the hospital. Some people have turned their hospital patients over to hospitalists, so you don't see all the specialists that you work with. It's hard to develop a personal relationship now that we're not engaging. Zoom is a good example, where, you know, less meetings, less face-to-face contact. This, I really worry about not having a personal contact. And if we go totally to Zoom, how are you going to get to know anybody, find out who you like or dislike, what you might have in common with some people, or what you might not have in common? So I think this slide sort of represents that. Next slide, please. So from an organizational standpoint, again, I think my push this year has been trying to educate and increase awareness. I don't pretend to have all the answers, assessing your needs and prioritizing. Again, you have to do this individually, and you have to envision, where your values are and where you want to go with them. Next slide, please. So if you find yourself or you find your colleagues having issues, you want to ask, what resources do you have available to help them? What's realistic from your organization? A lot of people have employee health things at the Allegheny County Medical Society. I think all of you remember we put together our physician support group that any physician having issues could call the organizations that we had set up. They could be seen 6 times for free, and trying to offer a lifeline to physicians who might not have wanted to go to their own employer to get help. And I think this is one of the things that got me interested in physician burnout. And I think what we need to do is foster more buy-in and that help people reach out when they need help and realize their help is out there. Next slide, please. So again, more or less, I think if we go down and try to identify your core values, what really matters to you, where you find the joy in medicine, and try to control those things you can control and try to influence the organization, and particularly if you're employed at the levels that you can affect. I think organized medicine, and particularly PAMED and Allegheny County Medical Society, have reached out to show people we want to educate, we want to help, we want to be there. We want to recognize the problems, and I think this is one of the strategies that can work for us. Next slide, please. So we all know organizations aren't easy. We know that sometimes they're tremendously frustrating. So what's realistic for your organization? What changes you can make, who you need to talk to, who you need to connect with, how you can help your colleagues find ways to help themselves, I think are not easy, but again, just another strategy to help people work through this. Next slide, please. Again, I talked about leadership, and I think leadership is so important in trying to help us work through this crisis. Again, I think staying accountable, promoting flexibility, should people be able to create their own office hours, have flexible time for vacation? Should CMEs be able to be carried over from year to year? Should people may want to take Monday and Tuesday off and work Saturday and Sunday? How we can make things a little bit more flexible and customize things. Not everybody's the same. I think organizations sometimes think everybody wants to work the same, be the same, and be motivated the same way, but we're all very individual, and I think medicine attracts individuals, and I think we have to try to get it across to our organizations that we're all not the same person and we all need to be taken individually. Next slide, please. So you might recognize at least one of these guys here. So we think about what other things influence us, and we know that the government has influenced us tremendously. We know that right now we're in the throngs of telemedicine, and unfortunately Governor Wolf vetoed the telemedicine bill that we've been trying to get passed for 3 years. I've been working on this bill myself with legislators. I've been up to the Capitol lobbying folks, and it was really disappointing when Governor Wolf vetoed this telemedicine bill. This was going to give us payer parity. It was going to give us rules for insurance companies to follow. And there was an issue with an abortion availability through the bill, and that's why he vetoed it. PAMED does not have a stance on abortion per se, and we really didn't want to get into the abortion debate. We really wanted a telemedicine bill, and we were so close, and disappointed that it didn't pass. I think most of you know I've been working on liability immunity. I've written to the governor, I've written op-eds. We're trying to get medical liability immunity for anybody who's working on COVID patients. As you know, he did pass an executive order that gave immunity, but he only gave immunity to people working in hospitals and working in nursing homes. He didn't give us to us as an outpatient. And the push I've been asking, we came out with a campaign that says, am I covered here? For example, I round in the hospital, I'm covered. I come back to my office, I'm not covered. It seemed to create more confusion instead of less confusion. But again, one of the ways that government can help us, prior authorization, as I mentioned earlier, has been a tremendous stressor for all of us to talk about bureaucratic tasks. We have been pushing the governor and the legislation to push prior authorization reform. We're not going to get rid of it totally, but we think this would help physician burnout tremendously. I know if you all know about venue, there's been a big push by the trial lawyers to have venue changes so that if somebody's sued in Erie, they can take the trial to Philadelphia. If somebody's sued in Elk County, they can take it to Allegheny County. We did away with that about 15 years ago, and now the trial lawyers are trying to put this back in. And if venue gets changed, again, it's just one of those additional layers of stress that physicians don't have to really worry about so much today, but would change the playing field moving forward. Next. So institutions have begun to organize and bring out wellness committees and wellness chief officers. Clinician satisfaction, I think, is improving a little bit with the institutions bringing out these committees and officers with ideas. For example, there are a lot of virtual opportunities now to have physician lounge activity where physicians can come together virtually and talk about things. There's been a lot of talk about mindfulness. I was on the floor the other day when one of the chief nurses came up and said they're going to bring mindfulness coaches up to the floors to work with the nurses twice a week. We've had some multiple retreats for UPMC. I mentioned the one where I met with a doctor who is a Buddhist monk. And again, all these things I think institutions are trying to bring out and let employed physicians certainly know that they're hearing them more than they had. Next slide, please. So again, I'm not going to go through all this. We're getting a little short on time, but you can see that all these are being pushed onto the institution. Again, just not here in Allegheny County, not just with Allegheny Health Network or UPMC, Geisinger, Jefferson, Stanford, Mayo Clinic. All these things are being pushed. We all think whatever little progress we can make makes a big difference for many physicians. Next. So every institution seems to be doing a little different. Coaching seems to be a nice term. Some physicians don't like counselor, psychologist, psychiatrist. They're more interested in just getting the help that they need. And the Cleveland Clinic has recognized that and put in a coaching system. Rush in Chicago has put in mindfulness meditation, mindfulness rooms, meditation gurus. And Mayo Clinic has done a lot of mentoring. That was Tate Shanafelt's initial project, and it's gone very well. Next. So what can you do on an individual level? And like I said, I don't pretend to have all the answers. I think when you listen to the experts, they say, control what you can control. Recognize your successes. Try to be flexible. Try to stay informed. Learn from other people who seem to be doing it well and doing it right. Try to fix what you can fix. And don't try to change government, Medicare, CMS overnight. Don't try to change Governor Wolf, Rachel Levine. Work in your own environment. And again, these are just some of the suggestions I think that make sense for everybody and are pretty self-explanatory. Next. Again, yoga, meditation. I can tell you that I went to Barnes & Noble the other day before it closed, and they had 2 tables with over 50 books on wellness and mindfulness and meditation. You know, I have to admit, I'm not oriented maybe toward meditation and yoga. If any of you know me, I go 100 miles an hour. But for some people, it seems to be working. And, you know, there's more and more evidence that these types of mindfulness and meditation seem to be helpful to people. There was an article in the New York Times the other day talking about the science of prayer. I mean, prayer's been around a long time. Is this a whole lot different? I don't know. But now people seem to be studying it more and more. Next slide, please. So I don't know if anyone recognized these people again. I'm the one on the right. But Deepak Chopra has written over 85 books. This is his most recent book, MetaHuman. You know, again, I'm not the biggest person to admit that mindfulness and meditation aren't necessarily up my alley, but when you listen to someone like Deepak Chopra, who has immersed himself totally into mindfulness, he makes a believer out of you, and his statistics and his examples are very, very impressive. You know, the yoga, the meditation, the mindfulness, the religion, the hobbies, service work, you know, the cognitive behavioral therapy seems to be gaining so much more popularity. One of my classmates from CASE has gone around the country and the world talking about cognitive behavioral therapy. I've listened to a lot of these folks at these different conferences. They're very impressive, and there's obviously a role for some people in this. It may not be for everybody, but I think if people want to read, Deepak Chopra is well published and a great person to introduce you to the world of mindfulness, meditation, and yoga. Next slide, please. So we're getting close to the end of our time. I want to leave a little bit of time for questions. Again, more suggestions on what you can do. I think formulating realistic financial goals was a suggestion given to me when I first started out in 1980. You know, live within your means. And this just removes one layer of concerns if you're doing that. Again, the last one I think is getting involved and getting involved in organized medicine. The amount of support I've had from ACMS and from PAMED, I can't begin to tell you how important it's been to me. And these organizations are there to help you, and they're there for you, and they have lots of resources to help you. So next slide, please. So this is one of my favorite quotes. It says, "Don't let making a living get in the way of making a life." John Wooden, the Hall of Fame basketball coach from UCLA, he saw a lot of young people during his lifetime, and I think he saw a lot of people who made a lot of money in their professional careers, but they had disastrous lives, and that the money really wasn't the answer to everything. Next slide, please. So again, this is a little slogan you might be able to use, self-care. You can look at it. And again, Kaiser Permanente put this out. I think they really, from an organizational standpoint, understand this. Kaiser Permanente has a large employment of physicians, and they don't want turnover. And this is just something that you might want to put in the back of your minds to think about. Next slide, please. So PAMED has really been very supportive of my trying to get this word out on physician burnout, wellness, resilience, and now this other layer of moral injury. PAMED has a lot of resources as well. If you go to their website, you'll see that they have a lot of suggestions, a lot of support. And again, I think PAMED has just done a tremendous job in supporting me, trying to get this word out and helping. Next slide, we're getting very close to the end. Just a few of the many resources from PAMED. Again, they're all on their website. You guys can find the website. And the next slide. So join the conversation. Be part of the solution, not part of the problem. I just had one other little quote to give you. Some of you have maybe heard this. This is Frank Lloyd Wright saying, "We are all here to develop a life more beautiful, more concordant, more fully expressive of our own sense of pride and joy than ever before in the world." And I think we try to do that each and every day with our work. We're so blessed to be physicians going out there, changing people's lives and keeping people healthy. And I can't thank you enough for all the good that you do, particularly during these very difficult times. I'm available to any of you at any time. Call me, email me, text me. I'm happy to help if any of you have any questions or anything I can do for you. I'm happy to open it up for any questions. I know we're a few minutes over time, but I'm happy to answer any questions. Jim, if you can open up any mics of people who have any questions, I'm happy to take a few questions. If people have to go, I certainly understand that as well. But again, thanks so much for being here tonight. It means a lot to me to be able to share this conversation with you.
Thank you, Dr. John. There's a couple folks with their hands up, so I'll unmute their mics first, and then we'll see if anybody else has questions. Dr. Lewis, are you still with us?
Can you hear me?
Yes, we
I
can.
hear you.
Oh, good, good. I just posted a question about the difficulties we have in dealing with the big health systems and the EMRs, and particularly this requirement about closing notes within 72 hours, which is next to impossible to do a good note and do that. And that's probably the biggest thing I hear physicians complaining about in my neck of the woods, that they spend all their time at night just doing notes and never spending time with their families, me included. How do you go about talking to these organizations and getting them to notice that it's not just about the bottom line, but about physician wellness? I just been curious to hear about any strategies we could use.
I hope you can hear me now. I can tell you that the electronic health record is the elephant in the room. We know that it is such a huge component to burnout. The problem is it was designated by the Affordable Care Act, and it's been forced upon all of us. And I think change is coming, but I think change will be slow. I think that, as you point out, just your issue with writing a note within 72 hours, I think the more we talk about that, the more we might say it's unfair, the more issue we have with it, that some things will change. I will tell you, I met with Dr. Varma, who was the chair of CMS, and she tells me that in 2021, the requirement for our notes, the documentation, the way we bill is going to be different. We're going to be able to bill for the time looking at the chart, pre-visit, time with the patient, time writing our note, and time follow-up, as long as it's done in that day. So instead of just counting the time that you're with the patient, they're now going to count all the time that you put in with the patient for that visit. And I don't know if that's a little thing, but that's going to change coding and billing a lot. But that's just one example of how I think this conversation has helped change things little by little. You just can't take the entire bite out. But I understand what you're saying, and I appreciate what you're saying. And I'm hoping that the healthcare systems are listening to our conversation.
That's encouraging. Thank you for a great talk.
Thank you. Any other questions, Jim?
Everyone's mics are open. If they wish to unmute and ask a question, they may.
Actually, Larry, that would be a big help, because if you go in to see a patient and you want to be prepared, so you put in the time ahead of time, and you look up their test results, and you look at their last note, that takes a lot of time, but that doesn't get counted in that face-to-face time. And so the more efficient you are with the patient, the less you get to bill for face-to-face time.
Well, I can tell you, I had a face-to-face conversation with Dr. Verma at a couple of these conferences. One was the AMA, and this other one I went to in Florida. And she and her support staff tell me that in January 1, 2021, you're going to be able to bill for all the time that you put in on that patient. Again, I think that'll help reimbursement, which is just one of those bubbles pointing at you is reimbursement. If we can help reimbursement and help documentation, they tell us there's going to be less necessity for detailed documentation. Again, I think people are trying to hear what we're saying, and that's in one of the ways they're doing it.
That's great.
And I will offer, I think organized medicine has had a lot to do with that. The AMA has been very forceful. The American Academy of Family Physicians is very vocal. I'm sure the internal medicine group has been very vocal about this as well. But I think these groups are really fairly representing us and expressing our concerns. Jim, any other questions? I do want to take a minute and thank Jim Ireland for helping me put this together, and for everybody at PAMED helping me put this together. I couldn't have done this on my own, and everybody's been very, very helpful. As I say, this is my maiden voyage for a Zoom presentation, and I hope it went well on your end. I thought it went fairly well on my end, so I couldn't have done it without everybody's help.
We do have a couple more questions. Is the AAFP working on better electronic record?
Yeah, I think everybody is working on a better electronic record. Some of you may not know that Microsoft and Google, and I've actually seen this demonstration where when you walk in the room, the electronic health record is going to try to pick up your thought pattern, and what you're thinking is going to be put in the computer on the chart. I've seen a demonstration. It's hard to believe that that can actually happen, but I have seen that. And that's just one example of how I think they're trying to streamline the amount of time that you're putting in on the electronic health record.
Another question is do you think with COVID-19 and the need to wear masks and PPE while seeing patients will make burnout even worse?
I think COVID-19 makes everything worse. You know, we could talk an hour about all the stresses that's put on the medical profession, you know, just trying to get the patients in the office, not shaking hands, not having the ability to see people's expressions. I think all this adds another layer of stress and demands on us, let alone worrying about our own health and the health of our loved ones while we go out and try to take care of these very sick people. So yeah, I think COVID-19's it's going to change the landscape of probably what everything we do moving forward in one way or another.
That was all of the questions that submitted. Is there anything, any further from folks on the phone or online here?
Well, again, thanks to everybody for taking their time out tonight to be with us. It really meant a lot to me to be able to share all this information and share this conversation with you. Please go out and find the joy of medicine and make every day better than the next or the last, or make every day better. So thanks again, and keep up the good work. And if I can do anything for anybody, just let me know.